Yeah, we are ready, Chair. Thank you.
Okay. Good evening, everybody. Has anybody looked at the minutes from the last 30th of January? Yeah, somebody. And somebody moved them?
Move them.
Second them? Yeah, thanks, Andrea. Okay, first up to now, we've got Greater Manchester Police Neighbourhood Forum. So that's Paul Suddens. Are you going to start off tonight, Paul? Can't hear you. I can't hear what you're saying, Paul.
It's Phil Davis here from Greater Manchester Police. Did you want me to start?
All right. Ben, Ben knows. Ben, who's doing the Greater Manchester Police Neighbourhood Forum?
My understanding, Chair, is it was Phil Davies, but I understand Paul Suddens is also here from GMP as well. I think Paul's managed to unmute himself now.
Yeah, I am. Sorry about that.
Right. So it's actually, so who's actually doing the presentation? Is it you?
Chair, if it's okay, I was requested by Sandra Stewart to provide you a briefing on the new neighbourhood model, but I can of course answer any further questions of policing for the area while I'm on.
Right.
That's okay.
Yes. So you've got.
Okay. Good evening, everyone. If we haven't met already or before, I'm Phil Davis. I'm the District Commander for Tameside Police. I'm the Chief Superintendent in charge of all the resourcing of the Borough of Tameside. And I'm here today to give you a short high-level briefing on changes to our neighbourhood model, which are being advertised across the force area and were launched by our Chief about 2 weeks ago. It's in relation to Tameside's policing, it is a relatively small change in what we do, but there's some significant things I need to cover off, which will be of benefit to the communities. So this input should be accompanied by a brochure. I think it was sent for attachment to the minutes. I don't intend to read it verbatim. I just intend to talk to you about the basics of the restructuring. So the restructure of neighbourhood policing is in direct response to a public consultation process about 18 months ago. And this was all primarily focused on visibility and neighbourhood engagement and problem solving, which we are seeking to improve with this restructure. The primary change that you're going to see in Tameside is in relation to availability and visibility of staff. Now, one of the changes we've made is by changing the shift pattern. The shift pattern that we had created a number of rest days in succession through the course of the year, which allowed for abstractions and it reduced our ability for officers who are dedicated to the area to be connected and engaging with you. So the shift pattern has been changed through consultation with the Police Federation to reduce the number of rest days through the year and just spread the work across the year a bit better. That's the first change, and that should hopefully improve the benefit to yourselves in relation to engagement with your local officers. The second thing in terms of the restructure was around allocation of teams across the 19 wards, but with a change in the mix of the team. So the police community support officer post is reducing in number and is being replaced by more warranted police officers. What that will mean is you'll see less PCSOs on the streets, but you will see more police officers on the streets doing similar jobs, but obviously with more flexibility for us in relation to using those warranted powers to fight crime. So on that basis, you will now have one dedicated PCSO per ward. The remainder of the team, which is going to increase in size, will be police officers. They will all be named and they will all be accessible to you in relation to your different ward areas. The final part of that connectivity process will be using technology better to engage with the communities and with yourselves as councillors. A new app is being launched very, very shortly called Be in the Loop, which will be a community messaging and alert service for things going on in your local neighbourhood, but also an opportunity to identify and communicate with local officers allocated to your beat areas. The officers and PCSOs allocated to neighbourhood policing from now on will have a ring-fenced structure. So for the last 2 to 3 years, due to the demands on GMP, there's been a lot of abstraction, both in terms of neighbourhood officers helping with response work, but also helping with force level events, football and marches and all that kind of thing. There's been some additional investment both in our specialist ops teams at headquarters, but also in restructuring our response model and working very hard to reduce our demands. And again, the neighbourhood policing function will help with that demand reduction as well. And that allows us to ring fence neighbourhood officers so they can dedicate themselves to crime, disorder, antisocial behaviour and problem solving on the patches. The final bit of the change I just wanted to mention to you is the investment in what we're calling the Prevention Hub. Now, that is a management resource for myself and my senior leadership team that will coordinate and manage and oversee problem-solving policing on neighbourhoods, and will also be the conduit into the main governance processes for engaging with partnerships. Now, the problem-solving work that's going to be undertaken in the neighbourhood areas, every single neighbourhood cop and their supervisors are going to get some particular training in and around problem solving. It's aligned to good practice nationally around how you solve problems in policing, which has got some academic rigor behind it, and it's already aligned to approved professional practice of the College of Policing. So we're going to improve the professionalism of the frontline cops, and their problem-solving activities will be managed in a way that this prevention hub can quality assure what people are doing and join the dots with problems and that kind of thing. So that's it, really. I just wanted to let you know that that change has already taken place. We did a soft launch a few weeks ago. It's working okay so far. It's not a significant change in Tameside because as a leadership team, we've been working towards this, knowing that it was coming for 12 months. So your neighbourhood inspectors won't change. Their geographic responsibilities that I've had for at least the last 14 months haven't changed. Some other neighbourhood functions around the force of having a bit more of a fundamental change. We've kind of been moving towards it for a while. So we're hopeful you won't see anything but improvement from the engagements you have with us in neighbourhood police work. And that's it for me as a briefing. There is a glossy brochure that should be attached to the minutes because we asked for that to be stuck onto the agenda pack of all 4 neighbourhood forums. And whatever allotted time I have remaining, I'm open to questions.
Okay, thank you very much, Phil. Does anybody want to ask any questions? Jacqueline North, do you want to ask something? You're on mute, Jacqueline.
Do you know, after all these years, still can't press that unmute button, can I? Just a really quick question. So how will our residents find out about their neighbourhood team? Where will it be publicised? How will they find the names out?
So that should all be on our Facebook pages already. There are some brochures that we can distribute, and we already have distributed through our independent advisory group, which should therefore go to the community watch groups. And if you feel we've got any other communication gaps, we can use our existing drop-in centres and meetings, etc., to spread the word. But every officer dedicated to neighbourhood policing will be available electronically. So we will publish it on our website and on this app.
Okay, would it be possible to have something that we could put out on all the neighbourhood Facebook and village Facebook pages?
Yeah, well, we'd really like to promote the app, so we'll send you the link to the app, and everyone can just click on that, and they should get access to GMP's Tameside team through the app.
Great, thank you very
We'll get
much.
that circulate. The app should be in the app should be in the pamphlet that I've sent you through if it's attached to the agenda.
Okay. Okay, thank you, Jacqueline. Councillor Robinson, Peter.
Thanks, Chair. I obviously welcome these changes. If we're moving to more neighbourhood policing, is there any possibility we'll get staffing back in Hyde Police Station?
You have staff in Hyde Police Station. You've got a full team, neighbourhood team in Hyde Police Station.
No, at the desk at the front door.
No, this initiative is not connected to the front desk. That's a force level function for public engagement. So this piece of work will not open the front desk for you.
Okay.
Okay, thank you.
Thanks, Chair.
Does anybody else want to say anything? No. Thank you very much, Phil, for coming on tonight and explaining all that for us.
You're very welcome, and I am happy now I'm aware of these forums that if you want to invite me back for any wicked questions on policing from time to time, I'm very happy to join in this public forum. In the meantime, I'm sure I can leave you in the capable hands of Paul, unless you no longer require any more GMP presence in the meeting.
Does anybody have any questions for Paul before he goes? Can we let them go?
Yeah.
Peter, have you got?
No.
Councillor Robinson?
No, okay. Well, it's lovely to see you all again, and I'll speak to you all soon.
Thank you. Bye-bye.
Thank you.
Bye. Right. Next, we've got equality strategy. Is that you, Simon?
It is, yes.
No. Yeah.
I've got some slides to show. Hopefully it's okay with you, Chair.
Yeah, that's fine. We can see them.
Great, thank you. This presentation is just a quick run through on the equality strategy recently adopted by the Council Cabinet last month. Members will be aware that the Equality Act 2010 places a number of requirements on public bodies, including councils, to do a number of things. I've not listed them all here, but two key ones are a requirement as a public body to publish data annually about the workforce of the council, which you can find on the website, and about the community that you can also find on the website. There's also a requirement on public bodies to publish at least one equality objective every 4 years. The council had a 4-year strategy, 2018 to 2022, which was joint with the clinical commissioning group. That strategy came to an end, and with also the end of the CCGs and the establishment of GM integrated care, we've adopted a new 4-year strategy, but that is just for the council. And that strategy 23-27 was agreed by Cabinet on the 8th of February last month. In terms of the development of the strategy document, which is in the papers pack, we did a number of things. The Local Government Association has an equalities framework that you can formally go through to get accreditation, or you can use it informally to inform your work. This year we used it informally, but you'll see later on one of the actions is to actually go through that formal accreditation process. We also did some work with Manchester Pride on something called the All Equals Charter, and we were the first council in Greater Manchester to work with them on the All Equals Charter. So we were a bit of a test case and worked them to develop the framework. We also did quite a lot of engagement with the Partnership Engagement Network. We also have a group called the Inequalities Reference Group, which I know Councillor Cooper is a member of, and that's shared by Councillor Feely, and it has a range of community groups on it, and they look into pieces of work or issues that the community have raised to look in more detail to see whether those issues have particular implications for particular protected characteristic groups. We also got feedback through community champions. We did a lot of benchmarking with other areas to see what their strategies were like. It's always good to learn from other areas. And then clearly, as we always do on these things, we looked at quite a lot of data to understand our community and our service users. The strategy has 6 objectives in it. So the Act requires us to do one objective every 4 years, but that's the minimum requirement. The work that we've done has led us to these 6 objectives. And you can see they're quite broad. underneath that, we'll be developing a detailed action plan. And again, I'm not going to put the action plan in detail up on the screen, but just to give you a flavour of the sort of things that are in there. So one element of the action plan is about insight and understanding. So, working to improve the monitoring we do of service users to understand their characteristics and develop a bit of a dashboard that tells us over time whether our workforce and our community are getting more or less diverse and in which different ways. Quite a big focus on access, whether that's language, physical access to services, digital access, Braille, easy read. So really focusing on access, and that's something that's come strongly out of the COVID experiences. Going to try and build a strong relationship with the Health and Wellbeing Board and Inequalities Reference Group to bring our equality strategy within there. The Council is going to review its Equality Impact Assessment procedure. The Equality Act requires public bodies to assess the impact of their decisions on equality groups. So in the Council, we have a form and a process to do that. And we want to look at that, see what we learned from the last few years and try to improve it. As always with these things, there'll be some staff training to help staff ensure that they work most effectively with our communities. And as I said before, there is an LGA, Local Government Association, equality accreditation. We did it formally this year. Our intention is to go forward and try to get formally accredited with the LGA. Just wanted to mention protected characteristic groups. The Equality Act 2010 has 9 protected characteristic groups, which are listed on the left-hand side there. But most areas also adopt some local characteristic groups that are relevant to their communities. So in Tameside, we've always had the 4 listed on the right-hand side at the top: carers, breastfeeding, armed forces veterans, and people with mental health support required. So those have always been our long-standing 4 local protected characteristics. But as a result of this strategy that's just been adopted, we've also included the socio-economic duty, which was part of the Equality Act in 2010, but was not enacted under the coalition government at that point. So now we've added that in, and we've also included cared for children and cared leavers. And that's important with our improvement plan work around children's services. So it felt appropriate to include them. I put the question there because really equality work is an evolving picture. So it may be down the line that there's other groups that we feel that we want to make a particular consideration of when we're developing new strategies or when we're making decisions. And then last slide for me on this is just some linked work. As I mentioned before, the Inequalities Reference Group, last year they had 6 work streams, which I've listed there on the left, and they've just agreed their work streams for the forthcoming year around debt, private rented sector, BME access to healthcare, and education attainment and skills. And that's a group of community groups that sit together and they almost operate in a way like a scrutiny function, which many members will be aware of, where they act independently, look at an issue, do some research, speak to people affected by it and make some advisory recommendations. And those advisory recommendations from last year have quite heavily informed this strategy and the following one around poverty. And then on the right hand side, just listed a few items there. One of them, White Ribbon accreditation. James Mellon came to the last meeting of this forum to talk about accreditation. So these things link together. Thank you, Chair. That's the slide to that item.
Thank you, Simon. Does anybody want to ask any questions? No, you all understand that fully? Yeah. Oh, Jacqueline North, Councillor North, do you want to?
Sorry, it just takes me time to click on my hand. Yeah, I always think in these things it's very useful, especially for members of the public that are listening in terms of things like when we talk about equality impact assessments, if we can just give a practical example of that.
Yeah, so a good example that affected everybody across the borough was the changes to waste collection services that were made last year to go 3 weekly on the blue and white bins. Can't remember now, but anyway, 2 of the bins that went 3 weekly. That if you look at the report, the decision report on the council's website and the cabinet papers, there's a full EIA in there. And what it does is it draws out issues, for example, and considering what the impact may be on people with disabilities and the need for polite return service, the impact there might be on families with children and the need for disposal of nappies, people with medical conditions and sanitary waste. It also picks up the issues of replacement bins and what it means for those on low incomes, and if somebody stole their bin, They can't afford that. It also looks at what it might mean in terms of communicating the changes. So one of the pilot areas was in Hyde, and reflecting the fact that not in some communities, not everyone speaks English as their first language, or there may be only one person in the household that does, that's a young person. So it tried to draw out a number of issues where you'll say, oh, it's bins, it's a universal service, this hasn't got relevance to equalities. But actually, when you get into the detail, it does. And that's why in the project, the pilot areas were chosen quite cleverly, that's the wrong word, carefully, to try to draw out those differences. And then the EIA is able to show that. So there was an exceptional circumstances policy, and there's also an exemptions policy, and then the communication of the changes made sure that there was materials available for people of the 5 main languages of Tameside. So that's a sort of practical example on a quite, well, not quite universal service, a universal service, because everyone has a bin of some colour, don't they?
True. Okay. Thank you, Councillor Nart. Has anybody else got any questions? No. Well, thank you very much, Simon, for that report.
Thank you.
Okay, thank
Yeah,
you.
I just advise that the just due to unforeseen circumstances, the presenter for the anti-poverty strategy isn't
Ben,
here.
I'm doing this one. Sorry, did you not get the message? Sorry, I'm covering this one as well.
Oh, I do apologise. Sorry, Simon. Sorry, Chair.
Right.
Yeah.
So are you just going to carry on then, Simon?
Yeah, that's okay. Yeah.
Yeah, you're next. So you're doing the anti-poverty, is it?
Yeah. So
Yeah.
you've bored of me already. Tough. I've got
Yeah.
another one.
No, that's all right. Well,
So let me just swap my slides. So hopefully you can see the new set of slides around that presentation.
yeah.
So this is a poverty strategy, which it's a council strategy, but actually it's a health and wellbeing board strategy. So it's a piece of work that's been undertaken by the Health and Wellbeing Board, led by Councillor Wales as chair. But obviously, as a strategy for the Health and Wellbeing Board, we as a council will adopt this down the line. You can see there the strategy is called Building Resilience, because it wants to focus on a positive aspect, that poverty work is not just about trying to put a sticking plaster on or to mitigate in the short term. It's got to be a long-term approach to mitigate, to alleviate, and then hopefully prevent in the longer term. In terms of evidence, as in the previous presentation, I just want to go through what work was undertaken to develop the strategy itself. So this is about a 12-month piece of work. We've worked with a lot of focus groups, took feedback from people using customer services, welfare rights, and spoke to people and what their experiences were in the community, what their challenges were, what services they needed to support. We did some very open, broad public surveys and conversations with the Partnership Engagement Network, so that everybody sort of had a view and an input. You'll be aware of the Poverty Truth Commission that ran for around 12 months and concluded in November last year. That's an independent piece of work by GM Poverty Action Group, and the recommendations from that are comprehensive and detailed, and we've adopted all those in the strategy. We've also taken feedback to the Inequalities Reference Group, which I mentioned in the previous presentation. And again, we benchmarked what other areas we're doing to learn for best practice, and with the LGA, we did some mapping. And then a really large piece of work was the need assessment, which isn't attached to these papers, but I'll send a link around. You go on the website, and the need assessment is a very detailed piece of work that goes through a whole range of data to help us understand our community, what the impact is. And that's like a comprehensive evidence base as to why these objectives and priorities are in this strategy. So I've just picked out from the strategy here, the slide and the needs assessment. There's loads of data, but can't go through it all, and I won't go through all of these, but just had to pick out a flavour of some examples. So 1 in 4 of Thames residents are over indebted. They're in a situation where they're struggling financially. We've got the 7th highest rate of insolvency in the country. 15% of people say they're experiencing food insecurity, and I think the latest figures show that rising. 1 in 4 working age claimants receive council tax support. So these are figures that give you a flavour, and as members you'll know this and your casework and talking in your communities, but this is some of the numbers that have underpinned the strategy. The Greater Manchester Poverty Action Group, which is an independent body, sort of pressure group and advisory group, they have just recently published a report on what is good practice in a local anti-poverty strategy. And this just lists the 10 key elements they think should be covered in an anti-poverty strategy. And then the box on the bottom right, the green box, is what we've been doing in the development of this strategy here for Tameside, and how actually that aligns quite well and effectively with the GMPA work. So that gives us some sort of benchmarking and challenge to say our approach to development of our local strategy was meaningful. You'll see in the strategy document, and I'll send the link round, we've tried to include quite a few case studies throughout. So rather than just being a lot of actions, there's some examples of case studies. And particularly we've put in examples where maybe in Tameside there's an action where we need more to do more. You know, there's a long way to go, and actually we've included case studies in other areas where they do that piece of work. So that's like trying to make the strategy itself come to life. There are 10 key recommendations or key priorities within the strategy, and listed there. And you can see that we're trying to look across the whole spectrum. So the first two are about work and income. So they're about long-term issues and trying to help people get to improve their incomes and get into work. There's actions around debt. The breaking the cycle life is about the best start in life and childhood, and that's really relevant to the next presentation that Faye is going to do on the early help strategy, that best start in life. There's 4 actions there around access to services, because that's a real challenge in helping people. And then at the end about advocating for change structurally within the system and lobbying national government, the council lobbying government about issues that are here in Tameside that help them understand down the future. And I think these recommendations show that this isn't just a strategy on its own. The equality strategy is relevant to this work. The early health strategy is relevant to this work. The inclusive growth strategy is relevant to this work. And it's that inclusive growth strategy that's driving the presentation that Julian and Anne are going to do later on in this meeting. So you can see this is nested within a short-term, medium-term and long-term approach to addressing, mitigating, alleviating and preventing poverty. So next steps, the Health and Wellbeing Board are developing a working group to get system-wide input and oversee the action plan. That's what we're drafting at the moment underneath those 10 priorities. And as the strategy has been adopted by the Health and Wellbeing Board last month, we're sort of putting out a call to action, sharing this document and the charter, which is the one-pager, which I've just shown you on the slide, and asking people to consider whether their organisation, their workplace, whether their community group, or as an individual, what can we all do to address the issue of poverty in Tameside? A bit of a call to action. That's the slides, Chair. Thank you.
Thank you, Simon. Has anybody got any questions on Simon on that one? No, I can say it looks pretty grim, Simon, that, doesn't it?
Sorry,
Really?
yeah, I can't find my hand, my electronic hand.
Okay. Okay.
I have to say I have an interest in this, in that I am a Trussell Trust trustee, and I do know that the Trussell Trust have, well, they do appreciate that there is an exec member who is named in the poverty strategy. They are asking that there's someone who is their entire job that to push forward this strategy. Where is that something that's going to happen, or is that not? Where are we with that?
In terms of an exec member, obviously that would be a matter for the leader of the council to decide whether there would be a specific portfolio just for poverty, not for me to comment on. In terms of the officer side, the strategic lead of this work is Debbie Watson, who's the Director of Public Health. Operationally, it sort of will sit in a number of areas, because things like, say, welfare rights and homelessness prevention sit in one department, exchequer services sit in another department. So there's a strategic single lead. At the moment, there's going to be a small working group of the operational leads. Whether down the line that morphs into a single role and a single person, again, we'll see. But neither on officer or member is it really for me to say what should or shouldn't happen. But I think there's certainly be a lot of coordination between the key officers in this to make sure we get that impact and look at it down the line.
Great, thank you.
Okay, thank you, Hugh. Any other questions? No. Thank you, Simon.
Thank you.
Right, we've got next, it's early strategy. Is that you, Faye?
It is, so it's early help strategy. Ben, can I ask you to present? I can try, but my tech abilities are not great.
Yes, if you just go to the bottom of your screen, Faye, I've made you a co-host. You should have a share screen option there.
Oh, look at this. Can you all see that?
We can, yeah.
Yes, we
Well,
can.
I've learned something new today. That's amazing. I'm sorry, that's probably about as good as it'll get. So I'll have to have the slides at the
If you just go
side.
to the bottom right corner, Faye, where it's got the percentage thing. If you see that's the
That
one.
the one?
Yeah.
Oh, it's gone all okay. Oh wow, that's thank you very much, Ben. That's very helpful. Okay, so I'm standing in today for Paula Sumner, who is Assistant Director of Early Help and Partnerships, to talk to you about the Early Help Strategy, which has been refreshed for 2023 to 2026. So in terms of early help, it says what it says on the tin. It's about identification of issues and needs and to try and stop them from escalating into statutory service. And when we talk about statutory service, that's about becoming part of children's social care. Within early help, as Simon sort of alluded to before in relation to sort of poverty, absolutely, it's a wide range of issues which families, children and young people face across the board. The idea of the strategy is to be able to incorporate all them together in terms of sort of our duties, our legislation, and to be able to make a pathway, a real clear pathway around what that looks like within early help and with our partners. So there's some sort of issues there in terms of obviously sort of what we would support within early help, which is right and proper. So you've got young people struggling at school, which is obviously underpinned by working together to improve school attendance 23. You've got mental health problems within family, and that's collective across the board. We have seen a rise in that in relation to COVID in terms of sort of what that looks like, and in particular with sort of the cost of living in relation to the mental sort of impact that's had on mental health with people. Young people where they are not brought to appointments leading to an unhealthy lifestyle. Children where sort of families have that toxic trio and are sort of substance misuse in relation to drug and alcohol. And as part of that, we've developed the TNAP, which is the Tameside Neglect Action Plan, to be really clear around actually sort of what that neglectful situation looks like for children and young people. And to support parenting capacity to be able to change that. And young people where sort of family members are involved with crime in terms of that sort of wider issues. And again, sort of parents financially sort of struggling in relation to cost of living and that sort of gap getting wider. That isn't an exhaustive list, but that just gives you a bit of a flavour in terms of sort of what that looks like for sort of some of the families in terms of what we're facing. I did pull off some figures just for South because I was asked at the last forum to make it quite personal. And in terms of the top 4% issues, what we've seen within the last quarter, it's been parenting support, it's been debt, housing and debt management and parent conflict, behaviour support and neglect. What we are seeing in relation to sort of parents struggling financially, it's not just about sort of food, it's not just about gas and electric, it's also about their living arrangements. So if they're in private rented, where the landlord has portfolios in terms of sort of property, because the interest rates have gone up, landlords have started to sell some of them properties, and actually that's where it's become really difficult for families to be able to obtain another property in relation to that. So we are seeing sort of a butterfly effect, if you like, in terms of sort of cost of living. So it just gives you a bit of a flavour in terms of sort of what we look for. In terms of sort of the support in relation to early help, it's across the board, and we work with various practitioners within schools, health settings, nurseries, etc., to be able to provide that early help in terms of that community offer that's out there. We have early help advisors that go in to support and coordinate that support in relation to what that looks like to provide that earliest intervention for children with special educational needs and disabilities as well, but across the board. Okay, so in terms of the reason for updating the strategy, we've launched our new thresholding document within children's services, which sort of documents universal services right the way up into statutory responsibility. And it sort of clarifies that sort of level of need and gives some really clear examples around actually what that looks like within families in relation to threshold. In terms of recommendations, obviously we're aware of Josh McAllister's review in relation to sort of the children's children's care reform, and then obviously sort of the government's response in relating to stable homes built on love in relation to actually sort of that child in need and what that sort of looks like to be able to respond at that earliest point. It clearly states in the Munro review that actually the earliest start within the child's life should always start at early help, and that's the best outcomes for children, and we still sort of maintain that today. We have the launch of the family hubs and the Start for Life programme, again sort of that opportunity for that early intervention, and as part and parcel of that, that, we know that the first 1,001 days of a child's life is the most important in terms of pregnancy to the first sort of 2 years of a child. So the family hubs is very much around sort of that start for life to be able to support that. In terms of sort of the South launch or the South sort of open day for that, that's on the 12th of April at 1 till 3, and that'll be at Flowery Fields Children's Centre, but it'll be called Family Hubs from that day forward in terms of sort of what that looks like. And that is that 0 to 19 offer to be able to support families right the way around and to bring them services to them areas to be able to support families. In relation to updating the strategy, we know that things have changed dramatically for us in terms of the pandemic and the sort of cost of living, as I've spoke about before. And again, for me, it's much more focusing on that multi-agency sort of response in relation to families. We know that a lot of agencies pulled back in relation to the pandemic when they were sort of dealing with sort of what was going on, and rightly so. We're now looking at actually that multi-agency coming forward and forming sort of team around the settings, team around the family, to make sure we're really clear about sort of aspirations within families and for children and young people. So in terms of our sort of key principles, which obviously sort of says it on the tin in terms of actually what we're trying to achieve, it's the right help at the right time from the right place within the right environment for our families sort of moving forward. It's underpinned by our listening framework in terms of what that looks like, and it's around that embedding children's voice within our practice and having that analytical overview and understanding the lived life experience of that child moving forward. It's around holistic approach in terms of families and bespoke to their needs. When we talk about early help, it's a very sort of fluid service. Yes, we do have our framework in terms of sort of following our statutory sort of guidelines for time frame and what we do. But actually, you know, if somebody says to me, I've got this family and there's this issue, actually it's about bespoke need in terms of what that looks like, because every family is different and that's the right thing to do. In terms of signs of safety, always very much relationship based and always starting from a strengths-based approach with that family. You know, parents, you know, are the experts of their children, and it's about harnessing that to make sure actually we're really clear about what's right for that family moving forward. And again, that support and help is delivered within families to build on their strengths and to look at their own support networks. So if anyone's had sort of the opportunity to read the McAllister Review, it does talk about sort of that community working and that community networking to make sure we're building resilient families within our communities who are able to help each other to be able to build on their networks. So in terms of what that looks like, as it says on the tin, you know, understanding safeguarding is everyone's business, exactly the same in terms of poverty, what Simon was saying before, that's everyone's business. And it's our responsibility to keep children safe and promote the welfare of children, absolutely. Within many situations, you know, we need that multi-agency approach. We now work in a trauma-informed response in terms of what that looks like, and have a collaborative approach to make sure that, you know, we can meet the needs of that family sort of moving forward. So as much as we're still child-centred, we know that the impact in terms of a parent's mental health will have an impact on a child. So actually, what does that look like? You know, everyone being confident in terms of data protection principles and sort of what that looks like. For the very serious case reviews I've read in my career within children's services, I've never read a serious case review that talks about we overshare information. It's usually we undershare and we don't put the jigsaw together. So it's about that professional curiosity and being really clear about what's going on within that child's life. And again, nobody should assume that that information's been passed on. We'd rather hear something 3 times than not at all, because actually we need to make sure we get a real full and fruitful picture of what life is like for that child. So in terms of consultation in relation to the draft, there's been 2 interactive workshops that's been held in relation to the voluntary community, social, faith and independent sector, health, council and police in terms of sort of moving that forward. And we are aware in terms of what's working well and what we need to improve within the borough in relation for sort of children, young people and families. We tend to seek further feedback from the following groups, as it says there, and there's an online survey being promoted on social media and has been circulated internally to partners for their feedback in terms of what that looks like, and to make sure that actually in terms of pulling them policies together, whether it's the poverty strategy, etc., that we're really clear, and actually it's what our contribution is to all that, to make sure we've got that seamless sort of policies and governance in relation to what the services that we deliver. So in terms of our governance and timescales, as it says there, we've got obviously online consultation and the public consultation ends the 26th of March. And then obviously we've got our governance in terms of the sign off in terms of what that looks like, and then the launch from there. So hopefully we'll stick to timeframes in terms of what that looks like. And obviously then we can get that sort of signed off moving forward. So in terms of our next steps, we've got the launch of the new strategy, which will be July 23, in terms of sort of its refresh. And then we'll work across the partnership to deliver and that implementation in terms of sort of what that means moving forward. Are there any gaps? Are there anything that we need to joint work on, etc., to make sure that we actually get it right for families moving forward? And then obviously we've got the governance and reporting process that will move forward in relation to quality assurance, etc., for both our partners and within sort of internal sort of early help. I think that's the end of my slideshow. Do I press stop sharing now? I'm so sorry.
That's all right. I'll stop it sharing for you.
Thank you. I am so sorry, Ben. My tech
No,
ability as a
don't worry,
4-year-old
don't
is
worry.
not great. So if that's okay, Chair, I'm hoping to any questions, if that's okay.
I can see everybody now. Could I just ask you a question, Faye? I know we're still having problems with the send from schools. There's big waiting lists for children to get onto that.
So I actually have got the written statement of action 6 in relation to SEND, which is a lack of contribution from early help and children's social care in relation to sort of education healthcare plans, sort of assessing them and sort of pulling them together. In terms of the waiting list, what we're doing is we're working really closely with health, parenting, etc., to bridge that gap in terms of the waiting list. I think the bit for me is it's around actually if you feel as a parent that, you know, our professionals feel in relation to that child having that diagnosis, then actually that parenting and support should start at that first opportunity rather than waiting for that diagnosis. And I think what we do is we put too much emphasis on the diagnosis. So what we've done is we now have within service SEND family intervention workers with very specific roles, north, east, south and west across the board. We now have active SEND participation officers in relation to positive activities and moving that forward. We now have a SEND youth council in terms of hearing their voice in terms of what that looks like. I'm due to go to the parent carer forum in terms of OKI to discuss our early help offer and what support and bridging is in relation to that, and actually what parents feel they need in terms of supporting that diagnosis. We've started to look at much more of a graduated response. So for example, we now offer 2 types of parenting course. One is the Solihull SEND parenting course and one is the Riding Rapids course. The Riding Rapids is usually what you need before in terms of sort of that diagnosis, but what we do, we offer that course across the board. So actually it's 24 weeks of support rather than 12 in terms of parenting courses. So what we're doing is we're working really close with our partners to be able to, I guess, bridge that gap, but also sort of upskill parents, because actually parents at that time, we know, go through a bit of grieving, they go through not really understanding, they don't know what the process is in terms of the pathway. So we're going through a lot of that at the moment. And I've recently just taken over ISCAN as the 1st of April in terms of the integrated services for children with disabilities, early help and children's social care. So we're doing a lot of work with them in terms of actually what that looks like to be able to support sort of families that are on that periphery and what that looks like moving forward. We're also updating the local offer website, and that's due to go live on the 20th of April, or we'll have sort of an initial understanding of what that looks like to be really clear, and that will also include the community offer, so parents have got a really fruitful sort of understanding of what that local offer is. And then we're commissioning somebody to be able to update that, so we've actually got quite a live and sort of real sort of local offer for parents moving forward.
God, that sounds really good. So hopefully that'll bring the numbers down dramatically then, shouldn't it?
Absolutely. I mean, I also sit on statutory panel. So when we're requesting that education healthcare plan, it's also about, is that the right pathway for that child or young person in terms of sort of their social need? It may be that an early help assessment is required earlier. And it's, for me, it's about, they may have that diagnosis and that plan may be required, absolutely, but it's to stop them families that are going into crisis in relation to what that looks like. We know that some, you know, the diagnosis for children is a lifelong condition. So it's actually how we go and supporting that through that transition at their ages and stages, which is right and proper.
Yeah, thank you. Anybody else got any questions for Faye? No? Thank you very much, Faye, for your presentation tonight.
Thank you. It was lovely to see you all. Thank you.
Thank you. Now, are we going on to the Hyde Town Centre plan now, Ben? Is that right?
Yes, we've got Ben Goodger here for that one, Chair.
Okay, thank you. Welcome, Ben.
Yep. Thank you very much, Chair. Yep. I'll so my name is Ben Goodger, Head of Investment Development. I've asked Jane come today to give you an update on where we're up to with the preparation and delivery of the Hyde Master Plan and delivery strategy. I've got some slides, so I'm just going to make sure I can get those up. Before I go much further. don't appear to be able to share away. I think that's it.
Yeah.
Can everyone
That's
see
all.
that?
Yeah, we can see
So,
that then now.
Yeah, apologies. That is on its side due to due to the size of the presentation. We just had to do a couple of tweaks to it, which means the first and the last slide are orientated the wrong way. But I'll alter that when we get to the last one. So if you just bear with me, I'll just. There we go. I'll just put it on full screen. So hopefully everyone can see that. Is that still the case?
Yeah.
Yeah, brilliant. So,
Yeah.
I mean, but before I jump into the slides, and like I said, there's a lot of detail in here in relation to the Hyde, the master plan itself. Just to give you, well, in terms of where we're up to in the process, so we've been working with appointed consultant team GL Hearn and Hemingway Design since sort of summer, autumn last year. Obviously, we've done a substantial amount of work working with them and stakeholders in developing and sort of looking at the baseline characteristics of Hyde. And where we're up to at the moment is we do have a draft master plan, an executive summary of which accompanies an executive report, which is obviously going to the March executive on the 29th of March. And accompanying that is a recommendation that we crack on and undertake a formal public consultation on the back of it. So in this presentation, there's the vast majority of the information that's in that executive summary. There's a few extra little bits and bobs, illustrative material that will make its way into the various consultation formats, which will follow. Just before I get into the presentation, like I said, I'll just give an overview of how the master plan set out. Just to give it a little bit of context, I think everyone is aware on this forum, but obviously the master planning process, it forms part of, well, the local authority is part of our strategic engagement with GMCA. We've got one of the growth locations within GM is the Eastern Growth Cluster, and as part of that we've got two growth locations, one of which is the Hyde Triangle, which is made up of Hyde Town Centre, the Godley Green development, and also Hattersley, as well as a consolidation of a number of major projects which obviously have a huge regeneration and growth potential. Critically, as part of that process, we've been engaged with GM around revenue and capital support, the revenue of which has come into the authority as supported development of the master plan. But a key part of that process is that we're trying to develop a proper project pipeline for further support and assistance going forward. So this process has been really key to that, and the work undertaken by GL Hearn is informing the work that we're taking forward with GMCA. Similarly, we've got the Hyde Task Force as well. So I think everybody's the High Street Task Force. So in 2021, I think everybody's aware again that Hyde was designated as a task force area, and we've had a series of engagement with some of the task force experts. And critically, some of the recommendations out of that have been about the town developing a sort of stronger long-term vision, more of a collaborative stakeholder environment, and also a series of sort of short, medium, long-term sort of priorities and objectives are going to be really critical. And the precedents across the UK is that's what's made a lot of town centre regeneration successful. And again, that's the approach that we've tried to set out, or the approach we've taken in terms of developing the master plan. So to just jump into that, so like I say, there's an executive summary that accompanies the committee report that's going to the 29th of March executive committee. And to start with, what that does is effectively trying to identify. So the first part of that master plan is work to try to identify what the sort of strengths, weaknesses, and some of the existing character of Hyde is. So as part of that process, there has been a number of positives, and obviously there's a range of strengths and characteristics about Hyde which are really positive in terms of the character, particularly around some of its historic buildings. It's got a really strong and vibrant cultural scene. It's got some good quality public realm, a nice civic core around the town square, and obviously the market heritage which goes along with that. I think unfortunately, as part of that process, it's acknowledged that there are some challenges with Hyde. We've got sort of some large big box retail that does constrain the town centre in its redevelopment. We've got a disamenity around existing buildings. We've got some underutilised sites, and we've got quite a dominant road network that impacts the town centre and does constrain it in terms of any redevelopment that might come forward to make it a bit more of an attractive, particularly pedestrian environment, but also about how we might bring together and consolidate uses in the town centre in a more of a productive way. So like I say, there's a pretty comprehensive baselining exercise, excuse me, that's gone on to inform that. I think critically as well, like I say, we're just about to enter into, subject to approval by the Executive Cabinet, a formal consultation process. But I wouldn't say it's unique, but an approach taken by JL Herney Hemingway Design is we have actually undertaken a good level of public engagement already. So there was a fact-finding survey undertaken in the early part of this year. It's worth saying that wasn't a formal consultation. We didn't actually consult on any proposals. What we did was try to engage the community and talk to them about what their aspirations were for Hyde particularly, but their local centres, town centres more generally. So how do they use Hyde currently? What do they think's good, and what do they think's bad about it? How would they like it to improve, or more generally, how would they like their local and town centres to service them? The feedback for that was hugely positive. So we have over 1,500 responses. About 1,300 of those were online questionnaires, but we did engage with 200 people attending in-person events. We had pop-up shop events in the Clarendon Centre and some of the other community facilities as well. So just on the right-hand side there, you can see loads of a good consensus on ideas that came out of that in terms of improving the market square, improving the look of the town centre through planting and greenery, improving the market offer, sort of building on the cultural offer that already exists in the town centre, creating more traffic-free areas. So lots of themes that we picked up through our baselining process, but have almost been ratified and reinforced through that exercise, which gives a really strong basis and a good foundation for the next bit of this presentation, which is what are the draft ideas that we think will help improve the area, which will obviously we'll be speaking to the community about post election and post approval by Executive Cabinet. So in terms of, I won't go to, obviously there's detail in the presentation. I'm more than happy to field any questions. Won't go into all the detail, but in terms of the approach taken for the master plan and the material that's been made public and that we'll be consulting upon, is obviously firstly developing a vision objective for the town, and from the point of view of the master plan, that's about re-establishing Hyde and improving the offer there to become a desirable place where people want to obviously live. There's a strong residential population in and around the town centre, but also shop and socialise. So sort of reinvigorating its role and function as a market town, and also building on its sort of heritage and community culture, and natural assets as well, with some really strong and quality sort of green space and public space around the town centre, and critically allowing sort of Hyde to sort of grow and flourish, but also find its identity with the GM context, but also relevant to Tameside as well. So, how does Hyde, engage and service its existing population, but how might that be attractive for visitors or new residents in the future? So again, key part of the master plan will be establishing that sort of clear and coherent vision to go forward. And then what the master plan does then, or the draft master plan, is set out essentially what will be a set of sort of development principles for the town moving forward. So again, the master plan is set up as a long-term strategy. So obviously there is detail in here as to how we think the town could improve and potential projects to bring redevelopment forward and other initiatives. But obviously it's a long-term project, and so the way in which that's sort of managed through the master plan is firstly development principles, so relatively high level development principles for what we think should be the focus for regeneration and development activity going forward. So like a summary of some of the key ones are on this slide here. So celebrating and enhancing Hyde's cultural heritage, obviously number of historic buildings, obviously a culture and heritage to the town centre in its market offer. Creating a vibrant, diverse and sustainable town centre, so looking very much at the offer of the town centre, obviously current, as came through the early fact-finding survey, clearly, a need and a want from the local community for the area to maintain itself as a retail service and shopping destination. But there's loads of ways to improve on that. For example, things like developing a nighttime economy, just improving that overall offer for residents. Creating a safe, desirable and healthy place to live. So there is an existing residential community in Hyde, obviously, but there will be potential to consolidate that and look at new residential opportunities. So again, key development principles about ensuring that you know, in terms of any new residential development or any improvements in and around existing housing stock is properly integrating those residential communities within the town centre context. We've got enhancing the character and placemaking of the environment. So again, looking at new quality, better quality public realm, enhanced public realm in locations. Like I say, we've actually got some really good public realm provision in Hyde, particularly around the market square, particularly around some of the peripheries of the town centre as well in terms of green space. But areas of the town aren't as coherent as others, and we've got sort of slightly poorer quality public realm in sections. So a real opportunity to look at that in a comprehensive way and make it work together. And what that then does is add to the sort of the next point really, which is around enhancing connectivity within the town centre, but also around the key transport nodes. So getting people moving around the town centre better, improving connections then to some of the really key assets for the town, which obviously it's you know, really good quality strategic connections as well, with its obviously access to road networks, obviously the heavy rail links and the bus station as well, acknowledging there are issues between interconnectivity between some of the town centres in the borough, but in terms of their strategic transport links, they're really, really strong. And the last development principle here that the master plan picks up is around unlocking the town centre edges. So we'll come on to just in the latter few slides some of the detail in the master plan about that. But there are opportunities. The town is from an urban form point of view quite inward looking to the retail centre, whereas there's lots of opportunities on the edge of the town centre to look at redevelopments or potential development or projects which could make the town centre work a little bit better as a sort of contiguous whole. So like I say, improving the performance of some of those sites on the periphery of the town centre. So what the master plan then does is get into a bit more of detail in terms of design principles. So if development or activity is to come forward in accordance with those core development principles, the master plan then gives some ideas, and like I say, these are drafts at this stage. Obviously, we'll refine these as part of the consultation process. So we'll be seeking sort of public feedback on the detail, but it goes into some detail to look at what some of those interventions could be. So we've got some on here looking at sort of the potential repurposing around the town hall complex, obviously at the very heart, the civic heart of the town. So what obviously there already is some diversification of uses within that building. Is there further potentially to do that, bringing in sort of maybe other income generating uses or potential for improvements in cultural community access. And then it goes into a bit more detail. I won't go through all of them, but pedestrianisation of key areas. Clearly, the redevelopment of the Clarendon shopping centre at the heart of the town centre is going to be one of the major catalysts for everyone's benefit. That we have been working. So we have obviously the centre was acquired, I think it was around sort of 9 to 12 months ago by the Martin Property Group, obviously in major retail investment commercial investment company. So we've been working with them as part of this process. So again, none of this is what necessarily will happen, but in terms of some of the principles that are driving this, and you can see looking at the retail core at the town centre, getting rid of that big box retail offer, opening that up, maintaining a lot of the use and function of the retail centre, but in a form that serves the centre a little bit better in terms of permeability and, you know, the promotion of things like late night uses. But so we've discussed all of this, and it's been developed in accordance with the Clarendon Centre. So we'll, you know, if redevelopment is to come forward, I think there's some shared consensus that these are the sorts of development and design principles that it should follow. And also picking up just finally on this slide, the potential relocation of some of the market facilities as well. Obviously, we've got an indoor and outdoor market function, and it's quite critical that as part of the redevelopment of that centre, we consider how that market offer can be maintained but enhanced as well as part of a slightly better quality and a much more functional layout for those uses. Again, don't want to get into, we'll just won't be able to get into too much of the detail, but what the master plan then does is obviously sort of prepare an overarching master plan for how, almost like, in an end state, if we're to seek out and deliver on all the opportunities, how might that look in a town centre context? Obviously, what this will then divide into is a series of sort of, I wouldn't say short, medium and long-term objectives. It's probably the wrong terminology, but there's clearly lots of improvements that could be made to the town, and some of those will be quick wins, both in terms of resource and funding. Then there'll be some much more significant interventions that will be really high impact, but they will require a little bit more heavy lifting. Obviously, some things work around the Clarendon Centre is a good example of that, but there are other development sites and opportunities that, you know, really could transform the town and its fortunes, some of which maybe, like I say, a bit more difficult to deliver in a bit longer term. But what this strategy does is try to set out, like I say, a long-term vision for that, so we can, you know, continue that process working with local stakeholders and some of our strategic partners as well. So as part of that master plan, again, I won't go into loads of detail, but it's try to split the centre up into character areas, and then the next few slides are just, well, what that provides is just some idea of what some of the priorities within that and what some of the deliverable projects might be. So critically at the heart of that master plan is going to be improvements to the retail core. Again, looking at some of the potential projects that might include, or hopefully that will improve redevelopment of the Clarendon Centre. As part of that process, we can look at improvements to the market offer as well. Also potential for improvements around Market Square, which again could be really positive. Potential for improved pedestrian environment, some pedestrianisation of streets around the town hall. Moving on to sort of the next character area within there, again, relatively high level, but really focusing in on that area around the bus interchange. Obviously a key arrival space for the town centre, people on public transport, but just due to its location just off the main road networks, really key gateway into the site. Obviously loads of potential around the bus centre, but there's a number of development opportunities as well. So a real focus there, on thinking about, you know, the appearance of buildings, what the connectivity is then from the bus station into other parts of the town centre. Just one of the last couple of areas, again, very much I think in this respect more of a long-term strategy for the Hyde master plan, but looking at areas around, for example, the train station. Again, lots of pre-existing uses in this location, but certainly in the sort of medium to long term, there certainly is potential and obviously precedent within other town centres within Thames, or the town and local centres within Thames, but particularly across GM and nationally, where new residential development around strategic transport nodes and around sort of waterside development has got some, you know, real potential. So again, in the long term, opportunities to bring some of those sites forward, and for the authority as well to look at working with some of our strategic partners in how we might think about delivery of some of these opportunities, and, you know, how we engage with some of the stakeholders in that area about that as well. And I think finally as well, it just looks at the area around Union Street in the town centre. Already a series of pre-existing uses in that location, but identified as an opportunity to look at movement away from what is a bit of a mishmash of existing uses to more of a residential but mixed use led offer. The idea of that being it provides a bit of continuity and a linkage with some of the residential communities that's immediately around that to the south of the area. So like I say, we've got some really established residential communities within the town centre, but like I say, trying to provide a little bit of transition from what's the retail core to through these neighbourhoods, and see that move out. And like I say, just to provide a little bit more of a contiguous urban form and some more complementary uses around, so a movement away from retail to a retail mixed use, then to obviously the core residential community, just so it, you know, there's a bit more of a feel of the town centre being part of a, you know, a proper contiguous sort of urban whole, rather than a series of sort of essentially neighbourhoods that are, you know, are split off from each other, simply by the fact we've got some quite differing uses and some infrastructure that's not really helping that either. So yeah, so I'm just going to, apologies for this, I'm just going to orientate this slide so everybody can see it. This is the last slide. So just in terms of the process, so like I say, we just to give you a bit of a sense of so I hope you can see that. I do apologize, the resolution is not brilliant as we've printed the PDF. So obviously there's information within the master plan there. There's more information, a bit more detail in the executive summary itself. Effectively, that information has been prepared via stages 1 and 2 of this process, which is the obviously the design development, and then obviously moving into stage 3, which is, again, apologies for the resolution, but the development of the concepts and ideas, and then obviously the optioneering that we see in this document. So like I say, through that baselining process, through the engagement with the community as part of the fact-finding mission, the fact-finding exercise, working with GL Home, we've got these concepts and ideas. Like I say, that's what they are at this stage. Obviously, they're informed, and we hope they're well received in the large part by the community as we undertake a consultation. But we'll be looking for feedback as part of that process. So the process, so we're in that hatched area in the middle. So the emphasis is now that, like I say, subject to approval by executive committee, we'll be cracking on with a formal consultation process. That's likely to kick on certainly post the election into the sort of late spring, early summer. We'll be preparing a more detailed consultation programme on the back of that executive approval, and we'll be happy to share that in with this and other forums, and obviously get feedback as to how we think that process should run. But that's the process we're starting at the moment. That will be generally, we'll have a formal online presence, and we'll be sort of wrapping around that a series of one-to-one and public consultation events, looking at addressing all formats. And I think the key thing is for this group, certainly, obviously, we'll make, obviously there'll be a range of communication surrounding that, and we'll welcome any feedback in regards to the approach. But similarly as well, we're really keen, obviously, to speak to as many people as we can, and different sorts of groups that we think that obviously get the opinions from a range of different groups. We're really keen to speak to everybody. There's obviously been a lot of conversations through the high delivery group about how we might engage with young people and particular parts of the community around the Bangladeshi community. So obviously we'll be picking up some of that through those forums, but if through this forum, if there's any ideas of how we may or may not be able to engage with different individuals or groups, please let us know. If we have to spend a day's preparation and an evening just to target a small number of people, if it's the sections of the community we wouldn't ordinarily speak to, you're pushing on an open door in that regard. We're happy to do the work. So yeah, I think, Chair, that is it in regards to the presentation. So I don't know if anybody's got any questions.
Thanks very much, Ben. It was rather very detailed, few slides there, but so we've got Councillor Robinson. Peter. You're on mute, Peter. Okay.
Right. Okay, thanks, Chair. Evening, Ben. I found that presentation much easier to follow than the one that we had the other night in the town hall. Very easy to see the illustrations. It's quite an exciting plan that we've got, and there's aspects of it that I'm very involved with already. But I wish you well, and let's hope that we can carry it forward. But we're looking 15, maybe 20 years project.
I appreciate. Thank you very much, Councillor. I think I agree. And yeah, well, it's probably a little bit easier in this format, but and I acknowledge, yes, obviously we had GL Hearn supporting the Wednesday session where they did get into quite a lot of the details. So yeah, appreciate it. I'm really pleased that's come across well. I agree with you. Loads of real positives in here, lots of opportunities. Clearly, it's a long-term strategy. I agree with that, and we do need to make sure we're managing expectations. One thing I didn't mention, accompanying the master plan itself will be a delivery strategy. So it's a master plan and delivery strategy. So as part of the process, we'll be working with the consultant team to develop a series of actions and interventions that we think can be delivered or should be delivered, and we'll have to, as part of managing those expectations, and the point you make there about this being long term, there are things we can crack on with in the short term. There's obviously, we had some really good discussions at the delivery group. It's great to see, obviously, members of the various groups already cracking on with some of those recommendations, which has been really positive. So yeah, so absolutely, but there is stuff we'll be able to crack on with, and we'll be using that delivery strategy approach to look at how we can, the authority working with stakeholders can support delivery as well through funding and other opportunities. So but yeah, absolutely agree. But yeah, there's lots to be getting on with.
Thank you.
Thank you.
Kathleen North. Councillor North.
Yeah, thanks, Ben. And it comes back to the point you just made about expectations. So the plan looks, very detailed and very comprehensive, but sort of when and how in the process do we start to assemble the funding necessary to carry out the different parts of the plan?
I suppose, yeah, so I think that will come as part of the delivery strategy. So yeah, so at this stage, obviously we're consulting on ideas really, but yeah, the really important bit's going to come when we look to start to deliver the vision and operationalize some of that. So it will be a delivery strategy. So on the back of effectively a consensus as part of the consultation about what that vision objectives are to be, we'll get into the nitty-gritty, and we already have started the process behind the scenes to start to look at what that delivery strategy will look like. So again, I don't like using the word short, medium, long term. We had a good discussion on in the week about that, because some of the big stuff might happen in the shorter medium term, but it's more about what are the quick wins, what can we get on with, and what interventions are likely to need that more of an interventionist approach, a little more heavy lifting. That may be funding, it could be other it could be about working with stakeholders. So there's a range of things. So yeah, so following the consultation, we'll get into the detail. In terms of the process, then we're looking at around autumn time, I'd say certainly towards the latter part of the year, we'll be looking at bringing back that final master plan and the delivery strategy, obviously for approval through the executive and the council governance structures. So it is at that point that we need to get obviously real and serious and be open about what we can and do and how we're going to do it or how we're going to drive that as an authority, because it's simply not going to be the local authority that's going to implement this master plan. It'll be a wide range of stakeholders, but we'll be the custodians of it as part of the master plan, obviously.
Okay, thank you. Councillor Colburn, Andrea.
I don't think it's to do with the master plan really, but I was just when you was going through your slides with the character areas, Union Street was highlighted. I mean, it's such a shame that we've not got the library anymore, because that would have been great for the Hyde heritage. But that was leading me on to my question is, what is happening with the library? Has it been sold? I know this isn't part of the master plan, but just maybe an update if you have got anything on that.
Yeah, so obviously, yeah, the master plan, obviously, it is included in one of those character areas. It was part of that the area to sort of the south of the town centre. In terms of where we're up to with the Hyde Library, obviously subject to probably previous updates, and obviously we've had previous committee approvals. The site has or is being marketed, so obviously you can see the signage up on there. So the council is seeking obviously someone to acquire the site and to work with the authority as essentially a delivery partner. So that process still is ongoing. So we've had a series of bids back from a variety of interested parties, some looking at, for example, retention of the historic frontage and working with the existing heritage of the building, some that don't do that. And there's obviously a balance there to strike between what are the sort of strategic outcomes the council wants to achieve versus possibly the financial incentives that come from the offer that's made. So we're still working through that process. So we are, like I say, hopefully in the sort of latter stages of sort of firming up what that options appraisal is, and then we can obviously make some clear recommendations to obviously yourselves as local members and obviously executive committee beyond that.
Okay, thanks.
Okay, thank you. Has anybody else got any questions? Astra, have you got a question? No. Thanks very much, Ben. That was very good presentation. I think it was very valuable as well.
Thank you.
Thank you. I think all we've got left now, Ben, is the date of the next meeting. Is that right?
That's correct, Chair. Yes. Which will be the 26th of June.
26th of June. Okay. Thank you, everybody. Thanks for joining tonight. And I hope it's been very informative. I think it has been tonight.
Thank you, Chair.
We'll see you all in June. No, not before.